I saw my role as trying to facilitate a meeting which could take the form of supervision in content, but it wasn't a supervision relationship, but could also take the form of like-minded professionals working together and just talking. So that would be the comradeship. And because our conversations were sometimes about philosophy, sometimes about politics, world affairs, sometimes the news, sometimes about psychology, clinical psychology, and sometimes they were me teaching concepts and things like that, I became really clear that it wasn't supervision, it's not mentorship. And I thought I really was trying to facilitate things.
And what do you think are the pros and the cons of having, I mean, I think the cons are quite apparent, but what, and as it's really ironic, but the more I do this program, the more I go, why do they need us? What's the point of me? So, except that I quite enjoy it.
I know, I'm like the odd one out. For people who have less clinical experience, I think the advantages are present. My experience was that they wanted some guidance from somebody who they believed was trained in a reputable, internationally recognized institution or worked in such a place. And so it provided reassurance to them. Right. Sometimes not just reassurance, sometimes input and education and teaching. So I think there is an advantage in terms of being able to provide input for people who have less experience or perhaps less training.
Yes.
When I was working with people with more experience, it was apparent to me that they were well trained. So the less experienced people doubted their training, if you like, but the experienced people didn't. They were well trained and really competent. And I think perhaps, if anything, they derived a sense of, yeah, we do the same. yeah, we're on the same page. And I think that's, validation and encouragement and I guess a checkpoint, I find enormously valuable when I talk to my colleagues and say, listen, what do you think about this? And when they say, yeah, that makes sense. What about this? I find that my anxiety goes down about something. And so I think there was more at that level for experienced people. And, quite often that would affect me for days. Like I would find that I would think about, say, one person's stance with their work, and I would be thinking about it when I'm working with a client and try and pull on that wisdom a little bit and pull on that centeredness, because I felt that, I think personally, I think it's got a lot to do with their language. I think, for the Syrians that I worked with, the Arabic language, I think, is a very rich and sensitive language, and it's quite a poetic language where the vocabulary is so sensitive to many things, and there's a rich amount of humor in everyday expressions and things like that, just the way that people greet each other is very spiritual. It's very kind, very musical. And it has a loveliness in its quality that, I sort of thought some of the expressions that people were using and the ways that they were interacting with each other, it sort of pushed any irritants away from their relationship.
So for me, I think what was challenging initially, but also interesting, is thinking, okay, so I'm supposed to provide some kind of experience in these projects, but in reality, it's the first time I'm working there, right? I mean, I've tried to understand the context. I'm trying to listen a lot and learn, but for sure, I don't understand it the same way as someone with lived experience of that situation. And then also, obviously, it takes some time to understand, I think, nonverbal cues and interaction and how you talk about things, how you give feedback. Also some time in a context where things change a lot. So I think in low resource settings, humanitarian settings, crisis settings especially, the atmosphere is very fluid. So the staff changes, the clients or patients change, everything changes a lot. So for people to build trust with you, I think it naturally just takes time, and you've also got a lot of things going on. So it was really interesting to work in different settings and providing very different services also to patients as a psychologist, and providing sort of peer supervision, but then also working on towards the end the standardization of sort of tools for supervision and how we could do that in MSF, and how we could have materials that help supervisors have a basis for discussing cases, for example, with supervisees. And that was really interesting to look at the research for that. I think one of the situations, if I can just talk openly, one of the situations that came to mind when you said, Scarlett, that you wanted to talk about this was that it took me some time to understand, I think, what is required in that setting. So from a management perspective, what was wanted was supervision in the sense of management a lot, and sort of assessing, are people who don't have formal training always in psychology, psychiatry, are they qualified enough? Are they doing a good enough job? It was very much about this kind of aspect, which is, it makes sense in one way, but it's not always very conducive to learning, because then if people are just being evaluated as doing a good job or not, they're obviously trying to perform. And the other thing is that even if you find that there's some difficulties that you encounter, then how do you help people overcome that? What's the alternative? So one of the situations that I had early on was that I thought, okay, with all these manuals, what do we try to teach? What are the interventions we try to teach? What are the kind of basic skills you have to teach, listening skills, assessment skills? But then it's also much more than that. So I remember a situation where I was working with a counselor who was seeing a client with severe anxiety, basically. And without going into all of the details, he basically then at one point decided that, no, I think it's not anxiety anymore. I think now probably he's got a problem with schizophrenia or psychosis. I thought, okay, so how come you think that? Sort of, what are the criteria for anxiety, and what are the differences between that and psychosis? And he could explain them fine. It wasn't a problem with that. It wasn't a problem with theoretical knowledge or with understanding it. So I tried to get him to talk about the client and the patient and the interaction, and basically what came out in the course of the conversation was that he felt very powerless to help him. So he was trying all these breathing exercises and trying to listen to where it was coming from, but it wasn't getting better. So he felt powerless to help him. So obviously the diagnosis must be wrong. So that was number one. And the second thing was that came out by having another person in the room, a translator, who was also saying, no, actually, I was there. I agree. Probably I think he's got like something with psychosis. And then I was talking to both of them, and they said, no, but it has to be that, because the fear is not realistic. So he's paranoid, clearly, because the thing he's imagining that will happen in the war, it won't happen. It can't happen. It must not happen. So it's also that was triggering something about their own fear. And I think that situation, even if I went into quite a bit of detail right now, that situation really stands out, I think, most in my memory. Yeah.
Hello. Yeah, that's such a lovely example. And it brings up some examples I have that's similar, but I won't go through them. But I think what I'm hearing is a bit of a theme of how valuable supervision is when you have when it's very easy to learn from a manual, and even easy from experience to do, sort of easy to do the work, but you can so easily misdiagnose or mistreat without having the support of supervision and other people who can give you another way of thinking. And when you are people, which is what we see with the Syrian psychologists that we're working with in our program, when you are working with practitioners who are they themselves traumatized or part or also in the same situation as the beneficiaries, it's very hard for them sometimes to separate their own projections or their own stuff from what's going on with the beneficiary. And that's where, as a supervisor, being the third eye and outside of that situation, it's so helpful, just like it would be in any other supervision dynamic. But it's so much more apparent when you are a supervisor from, you know, a somewhat safe and privileged situation, working with the practitioner who's not only working with those beneficiaries, but they themselves are in that situation.
Right. Yeah.
So I guess it'd be really good to understand from you, what are some tips you have, or some what kind of advice could you give to supervisors who are coming into this brand new and they are trying to give advice like you were, or try to get people to think about the kind of treatment they're giving?
I think trying to, well, I wish I had one tip or one really good advice.
Please,
I think
many.
trying to really understand the logic of what is going on, so what's drawing people to the work, what their physical environment is, because that it will help the understanding, and it will also help report to start very simple and start by, okay, so what's the physical environment? Can you take me around? Where do you do this counseling or whatever it is exactly they're doing? What is the setup like? How do people come there? Who tells them that they should go there? How do they get that idea? And what do you bring to it? How do you explain to them what you do? And just taking really the time, I think, to understand first. And then I think in a very semi-structured way, going through the logic of what they're trying to do. So they're trying to help in some way. They're trying to provide some sort of counseling. So what are they understanding of the problem or the challenge the person is bringing to the room? What is trying to help them think through this in a systematic way? What are the contributing factors? What happened before? And what would they like to change, and how? And then trying to think, are there other explanations? So in a very I guess in a very broken down way, going through different hypotheses and repeating that process a lot, regardless of the specific issue, repeating that process with different patients, different clients, so they then take on board to do a bit of that reflective process, I think, themselves. So I think because you inevitably will, or very likely, I think, we'll end up feeling like there's not enough time. There's not enough time to discuss every situation. Sometimes there might be bad internet, other things going on. There might be a change in who's showing up. So any situation you discuss with someone or listen to will only be an example of many, many other situations. So it's not just about resolving that situation, I think, but trying to go into what can they then take away from this for other kinds of situations. Yeah.
Yeah, that's lovely. I think I'm trying to summarize what you said. There's so much richness to what you're saying, so I'm so grateful that we've got it recorded and we have a transcript to go over. But in general, what I'm hearing you say, it's a really good takeout, which is that there is never enough time when you're working in this kind of situation. And once you recognize that, you can sort of relax into it and realize and be really clear with everybody that this is a teaching tool rather than a problem-solving vehicle, and then people can use it as a template for how to resolve other issues. So that's great. I think that's really important to remember. Do you have any advice or suggestions for supervisors in terms of how to give feedback? So I'll give you an example. What we found with a pilot program in the supervision program with the Syrian team, and the Syrian psychologists, was that they weren't used to a reflective type of supervision. They were used to being told the answer all the time. So, you know, if they said, oh, what should I do with this case? Usually an Australian style of supervision has some level of like opening the space for the practitioner to think for themselves. But the Syrian team sort of said to us as feedback that they weren't accustomed to that, and they found that confusing, which was lovely. But it took us 6 months to understand this. I don't know if you have other kinds of examples of how you cultural differences in supervision that you may have noticed and how you've sort of tried to overcome that.
Yeah, I think in some cultures, definitely Germany is an extreme example of giving feedback directly. It's very, very socially accepted to just be very direct and very blunt and very critical. Whereas in another context, it might be very rude and very much trigger a defensive response because what is this person? Why is this person saying I'm bad at what I do? You know, so even if it's not intended that way. So I think that one of the things I noticed in Uganda was that the team I was happy to work with was so polite and so friendly and so quiet that automatically I had to adapt how I speak to people and how I listen to people because I would have been far too loud, too fast, too direct. Yeah. Um, One of the things I noticed though was in the team meeting, people were often telling stories. So they weren't sort of directly saying, so point A, point B, point C, we will talk about is this with the agenda, but they would talk about a patient and a story. So one of the things I tried to start doing was to talk about sometimes situations as a story and approach them this way, and to also actually tell a story in return of a patient or a client I'd seen in a different setting, and what was difficult about it. And then sometimes people would open up more rather than if we just said, right, now we will do supervision. Please present your situation or tell me about your situation. So it was sort of this indirect way of entering into it with telling a story of something that had happened. Whereas in Germany, we would be much more like, okay, so right, it's supervision. So what's the situation you want to talk about? What are your questions about it? What do you think about it? What are your we would be asking lots of questions and prompting lots of direct reflection. So, which can be quite, I think, scary if you're not used to it, and also confusing because what am I supposed to take away? The other thing I would say is sometimes, and I'm a really bad example of this, right? Because right now I'm talking quite fast and a lot and around the issue, but sometimes the mental health literature and the way of teaching can be a bit abstract and conceptual. And some of these ideas, especially if you're not a native speaker or you're not, let's say, academically trained in psychology, they're just words. They're words that sound nice, like metacompetence or empathy. But I think it's important to be very specific about what that means and to also have open discussions about it. How would you, I'm not really familiar with the place where you live and work. How would you show someone that you're listening to them in your place? Or what could someone say to you if they disagree with something you're saying? To take time to understand that also. Yeah.
I've learned a new word from you today. I'm going to look it up. Metacompetence.
Oh, that's a bad example because you wouldn't say that in supervision. It was just something that came up in the literature where I sort of went, okay, right, what's going on?
Awareness about your competence. Is that what
Yeah.
metacompetence is?
No, an awareness of the limits of your competence, awareness of what you don't know or what you don't know yet. And that again takes quite a lot of reflection, right? Like
Yes.
the more you know about a subject, the more you also recognize what you don't know.
Yes. Very interesting. Um, I really like all the things that you're saying about slowing things down and being concrete, being aware, checking in with the group about the physical environment. I think that's really important, and not assuming that the language you're using makes sense all the time. So just at the beginning, when you're trying to understand, engage the level, not level, that's completely the wrong word, but
Yeah.
trying to gauge, yeah, the kind of English level people are at, I guess, or an understanding. You need to constantly be co-creating a language space. Even the word space can be very misunderstood as well. What else would be good to share? Do you have any other, I mean, maybe you could talk personally in terms of what are the things that you really enjoy about cross-cultural supervision and learnt from cross-cultural supervision? And then we might go into the things that are challenging.
I think the thing I most enjoy is that I learn so much myself about different places, about how people live and talk and interact in different places, and how also how, for example, trying to think of the correct word, how we would know someone is feeling better or what that means. I think what recovery means in different places can also be different. So for me, one of my fears really going into it, to be honest, was that, okay, but what if the situation is really bad in a place where I am, and I'm just this privileged outsider, and I get to leave at the end of it? And like, how can I really contribute anything to that? And what do you tell people if the situation has been bad, difficult for a long time, and will be difficult for a long time? But then in difficult situations, right, people still live there, and people still adapt in some ways, and trying to learn, okay, so what does it mean to be coping in that situation to different people? Or how would they know things are a little bit better? That was really interesting. And also learning what draws people to this kind of work, and seeing how passionate some people are to help other people, to listen to other people. So that was really, really rewarding, I think, and just learning, I think, developing with time a certain humility, and understanding your own assumptions about what is the correct way to do something, or the less correct way, or what is the technically beautiful way, and trying to figure out how to do things with fewer resources, less time. So what is the point where something is okay enough to help a person, but it's not the way maybe you would do it in a different situation. I found all that really interesting, and both rewarding and challenging. I think it's both at the same time. Yeah.
We can talk about some of the issues that we found around technology, around the fact that sometimes they're super exhausted, around you know, yeah, I mean the group dynamics, gender issues, all sorts of stuff that are manifest in that, and some people having the proclivity to talk a lot, and some not really having the space to, and how to bring that out in individuals. And hey, it might not necessarily be a circumstance that some Western practitioners have to deal with on a day-to-day basis, because, well, for the most part, a lot of our agencies are dominated by women, right? And so you might have 10 female therapists to a male therapist. In these contexts, it's a little bit different sometimes.
People are not going to arrive on time.
People won't arrive on time. People won't necessarily trust, and that's not a reflection of you, it's a reflection of their history. There is a lot of Ruth knows a bit more about it, but I've certainly had that experience in Bangladesh and in Syria, in Palestine, in those other two contexts as well, but in a more deeper way, I've experienced that when you're working with people who've had live in government or political situations that are not stable, what that can mean is when there's a lot of conflict in that environment, that creates insecurity, and people can get paranoid, but rightly so, about how information is used, and confidentiality. So if they don't share things with you, part of it is about that. Part of it is about, can be cultural, in terms of not wanting to, just like we can in Australia, not feel safe to share that you don't know, or that you don't understand. You might feel embarrassed. There is a real risk that I've experienced in the pilot program, where people worry that they'll be kicked out of the program because they worry that maybe they caused conflict, or maybe they weren't at the right level, or maybe they didn't have enough cases or whatever. And so they don't want to miss out on what they see as a way of helping to legitimize themselves as professionals or as psychologists. So, and all of those things are really normal, and it's good to be able to think through how you want to approach it, which is why we are going to run peer groups amongst the supervisors, so we can discuss some of these real issues that come up in the groups.
And maybe it would be good to explain why people might not arrive on time. So, you know, obviously you can imagine might be a lot of problems with internet connectivity. For people inside Syria, they might literally not be able to drive on the road that will take them into their office. For people in Bangladesh, it might be the monsoon season and the internet's not working properly, or they can't get to where they need to get to. And so there's a need to be really, really patient and understanding about the challenges that people are facing in trying to join the group.
Yeah, absolutely. I think that it's a conversation that I'll give you an example. When I spoke to the Bangladesh team about how to create a safe space in supervision, one of the things they said was, I feel safe when my supervisor says they're always available for me. And I said, oh, in Australian culture, that's considered as being not boundaried. And I said, oh, and it makes me worry about working, you know, with Bangladesh psychologists, because they may come across me as not caring or cold. And they were like, yeah. And we were sort of talking about what do we do when that comes up. And we said, yeah, it's just about having an open dialogue about what your boundaries are, but what you're willing to compromise on, if at all. And if you don't want to compromise on your boundaries, that's fine. That's okay. You have a valid culture as well. And it's just about explaining that it's not that you don't care, and it's not that you are cold, but this is the way, you know, your culture is, and this is how you are. And then that'll help them understand you and your intent.
Yeah. And I think the biggest learning that we had in the pilot program was around expectations. So understanding that the people coming into this program will have very different expectations, and just not have the cultural context around what we consider to be supervision and the purpose of supervision. And also that there might be a pressure to provide, to focus a lot on skills training, because people might see the idea that, you know, I need to have these skills and know these specific therapies, whereas then having an Australian supervisor who wants to slow down and focus on process, or focus on, you know, basic counselling skills and relationship building, might feel a bit strange. And then in addition to that, what's common practice in Australia is focusing on reflective practice. So creating an open space where people are encouraged to come to their own conclusions can be really challenging and threatening for people who have spent all of their education in a system which focuses much more on didactic learning, and, you know, learning these facts and then knowing the facts, rather than being expected to answer questions about their internal world in a group in front of people. That is likely to be experienced as quite threatening.
Yeah, absolutely. And so some of the things we have done to respond to that is, or at least I have, is be really overt and really aware of my own style of supervision and my own practice, and then give the option. So I will say to supervisees in other contexts now, this is my style of supervision. I learnt to be a reflective supervisor. And what that means is this, But I also know that some people really like more directive type supervision, which is this. What about you? What do you like? What have you experienced? What are the pros and cons of your past supervision? What would you like from me? And then I keep bringing a similar thing up every time I have a supervision session, but we've already had that pre-conversation. And so I'll say, would you like a open style or a reflective style, or would you like a more directive style? And they'll say, well, today I really don't know what to do and I don't have time and I'm really stressed. I just want you to tell me. And I'll say, that's fine. But other times they'll say, oh no, I just want space to think. And you can ask me questions and I feel okay about that. So it's more just letting you know that Australian supervisors often do come in with a style, and that's fine. But just being able to communicate what that style is to the group so that they can understand why it might be different to what they've experienced.
Yeah. And also, one thing to keep in mind is, what we will aim to have happen for everyone during the 8-month period. So we need to make sure that everyone has an opportunity to do a case presentation, because that's required for them to pass the course. And then once that is satisfied, then it's up to the group together to decide how they'd like to use the rest of the time. In the pilot program, a lot of people did want to be able to have specific sessions on how to do specific therapies and so on. And it really becomes a case of the supervisor needing to feel that they can share skills where they feel that it's within their area of expertise, and then find ways to support learning in other areas, which might include other people in the group having expertise in a specific area, or finding ways together to be able to learn about specific topics. But I guess I would say, from the perspective of the Australian supervisors, it can feel overwhelming at times when there's a lot of people in the groups who have such a big desire to learn and so many things that they want to learn, and there's only so much you can do in 90 minutes a fortnight. And so that's something that we hope to focus on together in peer supervision, is how to kind of prioritize and also keep yourself safe.
Yeah, absolutely. Because we did this pilot program and we picked up all these learnings, we can sort of give some suggestions, I guess, and advice, but really you as a supervisor will be able to gauge, and it will be uncomfortable because it'll be something that you haven't done before, but through building the relationships with the group, you'll come through to a place that feels more comfortable. But hopefully with the benefit of some of these learnings, that period of uncomfortableness will be shorter. And some of the things like what you're saying, Ruth, that I think really helps is spending a lot of time at the beginning of those 8 months to really establish expectations, goals, rules, and a timetable for who's presenting, and then after that, what kind of learning goals there are. Knowing that, say you have 8 months, you have about 16 weeks, if you're able to run every single group. So if you have 6 people in your group, then you have about 10 sessions left, maximum, to be able to do some sort of other learning program. So yeah, just really being able to collaborate as a group on how you want to spend that time. And because there'll be people from all different learning developmental stages, it'll take time to come to a place where everybody's comfortable, and that's okay. That's the nature of this real life program. But I think, yeah, you can avoid some of the things that we learned in the pilot if at the beginning you invest, a good 3 sessions, I think, in establishing expectations and the roadmap for your group?
Yeah. So I would, I'm just thinking about trying to get this bite-sized, because I really like what you just said. So maybe, one of the things that we learned from the pilot program is the need to invest a lot of time at the front end to make sure that everyone's expectations are aligned. And we've created some resources to help with that. One of them is a supervision contract template that you can negotiate with your group, but which has some of the specific details of this program. And then another thing that we suggest is perhaps to provide an example of a case presentation yourself early on, so that people can understand what a case presentation can look like. We also provide a case presentation template, but what we found is that it was quite anxiety provoking for people to, know what was going to be expected of them, and obviously in a new group to do a case presentation and be the first person is really, really tough. So, perhaps spending a session just talking through a case yourself and showing them, what the important elements of a case presentation are. And then everything that you plan to do in those, say you spend 3 sessions setting the group up, everything that you plan to do, divide it in half, because everything takes twice as long when there's translation.
Yes. And I'm going to do a video demonstration in a separate file, showing how I guess a presentation that I have done for supervision groups about how to introduce the ideas of rules, expectations, and also safety and all that kind of thing, but also a structure of how to facilitate groups online, and so that everyone can have buy-in to that structure, and then what your role is. Otherwise, it can be a bit chaotic if we don't have an agreed upon process for doing group supervision in the group. So it's a suggestion, but yeah, I know it's a suggestion, but it's not a must do. Everything we're doing here is a suggestion, but I know that a lot of the people who are in this program and have volunteered their time are actually very, very experienced, very wise, and I trust that you have all the tools and and you have an idea. But at the same time, there are people who don't, or who really need and like having guidance and a template, and that's what these videos are for as well, for people who would like some ideas about how to do it.